The social stigma associated with substance use and substance use disorder is often embedded in the ways that workplaces deal with those who are or who have recovered from the disorder. Join me for a conversation about what it takes to create a recovery-friendly workplace. Up next on this episode of the Psych, Health, and Safety USA podcast. From Flourish DX, this is the Psych, Health, and Safety USA podcast. As workplace mental health has become a global priority, there's a greater focus on addressing psychosocial hazards. Each week, we look at psychological safety from an occupational health and safety perspective. Let's talk psychological health and safety. Welcome to this episode of the Psych, Health, and Safety USA podcast. I'm your host, Dr. I. David Daniels, and I want to thank you for tuning in. Our goal for each episode is to increase awareness of the importance of psychological health and safety by learning from the lived experiences, research, and expertise of our guests, as well as advocating strategies to reduce harm and minimize vulnerability to psychosocial hazards in the American workplace. So in this episode, we're going to shine a light on the power of psychologically safe workplaces. And at its core, a psychologically safe workplace is one where people are protected from hazards that can harm their mental, emotional, and social well-being. It's about more than just avoiding stress. It's about creating an environment where dignity, respect, and equity are non-negotiable. Now, here's the connection. A recovery-friendly workplace thrives when psychological safety is the foundation. Why? Because recovery isn't just about abstaining from substances. It's about belonging and trust and the freedom to be authentic without the fear of the stigma. When organizations commit to psychosocial safety by addressing workload pressure, eliminating discrimination, and fostering supportive leadership, they're also building conditions to make recovery possible. Think of it this way. Psychological health and safety is the soil, and recovery-friendly practices are the seeds. Together, they grow cultures where people can heal and innovate and contribute fully. Employees that see their humanity is valued can also create resilience across the entire workforce. So in today's conversation, we're going to explore how the connections between these two concepts, between, again, psychosocially safe work environments and recovery-friendly environments. They're really kind of the same thing because you really can't do one of them without the other. And so I have the pleasure in this episode, we were sharing before I pushed the record button, that sometimes I meet people for the first time and don't really know exactly what they're going to say, but I think they're going to have a lot of expertise on a topic. Well, in this case, I have a good sense about what my guest is going to say, and I'm convinced about his expertise in this area. So we're going to get started, as I often do, with an introduction of my guest by my guest. In this case, with this question: who is David Shapiro?
Well, thanks so much, David. I really appreciate the introduction. I want to live in that soil and in that garden, and where you're describing with the fertile soil and the plants and the seeds of recovery-friendly workplace. I'm ready for that sense of well-being on Earth. Anyway, David Shapiro. I am a white man in my late 40s. I live in Colorado, and by training, I am a cultural anthropologist and sociologist. And what I've come to realize over the course of my career, I'm as I mentioned, in my late 40s now, is I used to think when I studied culture, I had to go overseas to developing countries. I spent a lot of time in Africa and Southeast Asia, and I was like, oh, that's where culture is. And what I've come to realize is there's culture right here in our workplace. There's culture in our nonprofit organizations, and it's worthy of looking into and better understanding. And so professionally, I'm a public health practitioner. I work at the Centers for Health, Work, and Environment, which is located at the Colorado School of Public Health. We're on the University of Colorado Anschutz Medical Campus in Aurora, Colorado. My title is Assistant Director of Programs and Partnerships. And the two programs that I run for the centers, one is a total worker health practice outreach program called Health Links, where organizations get certified as healthy workplaces. And the other one that's really grown in the last few years is Colorado's Recovery Friendly Workplace Initiative. I'm a really big believer that workplaces are really powerful environments. There are places where people find connection, dignity, and healing. And my personal mission is to elevate the strengths and assets we bring as a diverse set of workers, especially people in recovery, and help employers build supportive cultures. I am a person in recovery, and what that means for me is I'm abstinent from cannabis. I had a long run, over 25 years with cannabis, and labeled myself as someone with a severe cannabis use disorder. And now my version of recovery is I'm abstinent. I choose not to use that substance at all. And yeah, it's been lovely getting to know you better, and getting to work with workplaces, helping them understand that substance use disorder is a medical condition, and there's a lot of people in recovery in the workplace right now, and trying to figure out ways to do a better job supporting us.
Right. Wow. Well, we're gonna dig into those topics in some detail. One other standard question, though, before we get to that: what does psychological health and safety mean to you?
Yeah. I talk about psychological safety a lot in consulting with organizations, but really, for me, it's about feeling comfortable speaking up. And that speaking up is multifaceted. In a safety-sensitive business like construction, speaking up would be, maybe we need to stop work for a second because there's something I find hazardous going on, and I want other people to check this out and make sure that I'm okay and my colleagues and my friends are going to be okay. I haven't worked on too many jobs where people don't feel comfortable speaking up, but I've heard stories where that experience of speaking up to stop work can have really serious ramifications on the business and on the individual. So first of all, speaking up, feeling psychologically safe, and I think there's a health component of that too, that if you see something, you say something. Just like we tell kids, we tell people in airports, etc. And same thing on the workplace. The goal of feeling like you can speak up, not only about safety, but about yourself, about your own experience, your own medical background, how you're coming to work and showing up each day, is that we're building cultures of trust. We're treating one another with compassion and care like human beings and respect. And that there's sort of a shared responsibility amongst us as individuals and leadership just to better understand that psychological health and safety is a thing, and that, people want to talk and they want to feel comfortable bringing things up that are often uncomfortable. So for me, that's what it means, is creating a culture of comfort and ease, especially around things that are traditionally difficult to bring up.
Wow. Well, yeah. Well, speaking of things that are difficult to bring up, I'd really be interested in getting your view. So standing back, looking at the workplace, primarily here in the U.S., but the workplace in general, and how workplaces address things like substance use disorder, things like recovery. How, the folks who haven't had the training or haven't had the conversation, what does it look like to you? I mean, what's your assessment about how that's being handled right now?
I'll tell you, David, it's all over the place. There's no standardization, right? And so I have the advantage of having worked with companies on supporting individuals with a variety of medical conditions. People with cancer, people with type 2 diabetes, people with cardiovascular disease, hypertension. And for pretty much all of those chronic medical conditions, most of the HR managers, wellness professionals, and to some degree safety professionals I talk to say, here's what we do. Cancer is always the one I talk about, right? We all are in the fight against cancer, right? We all do the things, we do the walks, we provide support, we provide accommodations that when people need time off for treatment. Cancer supportive workplaces, I think there's a playbook of what we're going to do because we're all aligned in the fight against cancer, which we should be. Substance use disorder, there's no playbook. There's no alignment. There's no standardization. And so the first thing we need to do in working with companies, small businesses up to really large ones, is making sure people understand that substance use disorder is a medical condition. I don't think we're there yet as a society, that people understand that substance use disorder and addiction are medical conditions. that people have. And so when we share information about how opioids affect the brain, or what an alcohol use disorder looks like, or even cannabis use disorder, which is behind those two in terms of research, I get the advantage of working on a medical campus. So people are researching these conditions and translating that science to the business community to make sure that we understand, okay, this is a medical condition, and therefore maybe we can take some of the moral judgment out of how people cope and the type of substances they use. And we could have a playbook for how we address this medical condition like we do all others. That's where I'm hoping we get to, and that's part of our initiative, is this baseline understanding that substance use disorder is a medical condition, it's treatable, that recovery is possible. But right now, it's often a shame, stigma, silence, and punitive nature of how workplaces handle this specific medical condition. And when I hear these stories of zero tolerance, of firing people on the spot on things, the first thing I always say is safety comes first. And if there's legitimately a situation where someone has put their own safety or the safety of their colleagues or community at risk, well, yeah, termination may be the right measure in that moment. Maybe. But it's not my go-to, right? The go-to is something's going on with this person. Maybe they're sick, right? And if that person was getting treatment for cancer, I don't think our response would be immediate termination. But because psychoactive substances are involved, and because of our own interpretations of impairment and what that looks like and means, the standard response has been termination or really punitive consequences right away. And so sometimes with companies, we're just saying, hey, let's make sure we get safety secured in whatever workplace environment we're a part of. And then let's treat the worker like we would a family member, like we would a friend, like we would a neighbor, hopefully get them the support and care that they need and treatment, maybe hopefully give them a chance to come back to the workplace, just like you would with any other medical condition, with reasonable accommodations that work for both the employee and the employer. And then let's go from there. But right now, we're not in that place. And I think it's because of stigma. It's because of preconceived notions. It's because it's as much as we're talking more about mental health things like anxiety and depression, substance use disorder is well behind the curve in terms of what businesses are talking about and what we're willing to go to. And there's a rise in cannabis sales across the country, right? There's a rise in legality of cannabis, right? Alcohol has its ebbs and flows, but we've seen all sorts of other pharmaceuticals and other substances flood the market. So at the same time where we're trying to figure out a playbook, the reality is people are using new and different substances all the time, just like we're discovering new diseases, but we're not approaching it the same way as the other medical conditions. So, yep.
A couple of points you make me think about, particularly from a occupational health and safety perspective. It honestly bothers me that you will have organizations who have someone who develops substance use disorder, and if you do the investigation, you find that the substance use disorder started when they were injured at work and they were given something to deal with the pain at work. But why aren't we tracing back to find out what was the hazard the person was exposed to in the first place that they didn't recognize that caused them to get injured, and the treatment that they got? There's all this stuff behind it. And in many cases, your lack of focus on the health and safety of that person in the first place contributed to the situation that they have, or the fact that you don't pay them enough, or the fact that you bully and mistreat them, or the fact that you discriminate against them. That is what is driving their use of the substance to deal with how they're feeling at work. I've had more than one person tell me personally, my boss is so difficult to deal with, I have to smoke a joint on the way to work just to be able to deal with them. Seriously. I've had those conversations with people. And being from, you live in Colorado, I'm from Washington State originally. These are legal substances in these states based on that's what the people want. And frankly, the moralizing and what you think about it really doesn't matter all that much at this point. It is what it is. And perhaps we could treat it as what it is and not what we thought it used to be. That leads to my next kind of curiosity. Again, just trying to get your thoughts and perception. I see a lot of the ways that we treat people in the workplace similar to our criminal justice system. That we have these perceptions about what should and should not be legal, and we assume that people are guilty, and we start enforcing a bunch of penalties, and sometimes we don't do the investigation at all. It's just, that's a crime, arrest them, put them in jail, make it punitive, so on. And we're not really reforming anyone. We're not really helping anybody, and it costs us all a lot of money. So talk to me a little bit about the connection between how we see substance use in the workplace and how we see it in the community at large.
Well, first of all, I have a little bit of a different take on the individual who needs to use cannabis on their ride to work to deal with their boss, right? Like there's some other ways to cope.
There are,
right?
no
like,
question.
That are healthier options,
Absolutely.
right? And that's,
absolutely.
you're speaking to someone who, had life situations like that in the past. And what I realize is now I was actually avoiding difficult conversations. I was actually this was a two-way street. It was not just the leader, the manager, the boss. It was also something going on with me. That's how I chose to cope.
Absolutely.
Right. And the other thing I want to mention, because you brought up pain management and prescriptions, that is a pathway. The other one is, let's look at how we congregate and celebrate in certain industries. And alcohol is pretty common in a lot of sectors and industries on how we get together, what we do after work. I'm not going to point any fingers, and I'm not saying that we need to go away from that in any means. But we can moderate it, and we can have a variety of options. But if the only chance for promotion in the tech sector or in the finance sector is to go out after work and partake in whatever the leadership is doing, well, you might be limiting your opportunities to advance in that sector or industry if you don't want to do that. And I talk with construction sector partners all the time where the lunch break has certain things that we do, and after work, this is what we do. And I know you come from a public safety background, and there's all sorts of industries where it's just accepted that this is what we do to bond with one another. And all I'm saying is I don't want to ruin anyone's party. I think there is a role for that, but there's multiple options. It's not like that's the only one. And so that's one thing. In terms of like the criminalization of it, it's interesting you bring that up. We work a lot on policy development with companies. And one of the shifts I've worked with companies on is if something looks weird, the policy is reasonable suspicion. Suspicion is a criminality word. Like unless you see someone injecting themselves, smoking something, drinking something, just like any other safety reporting, you have to be objective with what you put down in the report. And so if someone is stumbling or slurring their speech or impaired to a point where they can't do their job, that's what you note. But reasonable suspicion and that policy kind of almost encourages us to make an assumption that it's not lack of sleep or a stressful family situation or a medical condition or a concussion, right? Like we don't go that route. The way that the policy is worded is we're kind of looking for impairment due to a psychoactive substance, and that's reasonable suspicion. And so it really could be reasonable cause. I'd like reasonable concern. And I've worked with some pro bono legal help to say, like, it doesn't really have to be suspicion. It's just how we've created that sort of kind of legal policy. And the last piece I want to mention is what I've noticed in the interactions with individuals around recovery, and this is more so than any other chronic condition I've talked to human resource professionals, safety managers, wellness professionals about, is there are deep personal connections to substance use disorder, right? This is not just about criminalization in certain communities. This is about my parents, my partner, my child, my friend, and what their experience was like. And I don't know that people are able to necessarily compartmentalize their experience around substance use disorder in some of those personal domains, which what they're encountering in the workplace. People have opened up and shared the most vulnerable and amazing stories with me over this condition. It's been beautiful and it's been wonderful, and it's helped me feel more comfortable sharing my story as well. But I don't get those same stories around cardiovascular disease and type 2 diabetes. Sometimes cancer, but often not. It's all like what we're doing to fight cancer. These are like heart-wrenching stories about people that supported individuals. And I think that's more the lack of clarity we have in the workplace, is because people are coming at this with like so many different individual experiences. And I think to some degree it not necessarily clouds, but they bring that into how they approach the worker. There's no way not to. So yeah.
Yes, I mean that so the concept of psychological safety and the one around psychological health and safety often get mixed. The words they sound very similar. They are certainly related, but they're slightly different. Where this conversation about psychological safety and this idea that we can bring our whole selves and not worry about the group mistreating us or treating us funny because we're different is one thing. But we often don't have systems or cultures to be able to support that. So you can get psychological safety by accident. The three of you went to school together. You're all you came from the same neighborhood. You see the world similar, and of course it's comfortable for you. But then this different person shows up. This different person has whatever. Pick the thing that's different about them, but they perceive this as slightly different. And now I brought my unique self and I'm treated differently in these kind of subtle ways. I don't get invited to the social event because I don't participate in that. I don't eat that same food. I don't consume those same kinds of substances. And similar to you, I'm not trying to moralize either. I consider myself to probably be kind of libertarian. It doesn't really matter to me really what people do as long as they're not harming other folks. It's a free country. If that's what you want to do, that's fine. I'm not here to judge, but why is it that I'm excluded if I don't want to do it that exact way? If we are trying to build a relationship particularly to accomplish some sort of business imperative, why does it matter that you drink, I don't, I drink, you don't? Why does it matter that you have, trauma in your history in one area, I have trauma in my history in another? But we've now built a business around that. We've made, getting promoted, getting a particular assignment. It's built. I have a set of clubs. I'm not a golfer though. So, but if I don't go play golf, then I don't get that opportunity that somebody else got. Then I start thinking all kinds of other things. And so again, I'm simply, and this again is how these topics go together. Business, organization, for-profit, nonprofit, when human beings get together, it should be about the thing we are trying to accomplish and not all these other things that are going to come with us. But what do they have to do with this? What do they really have to do with this? And we may approach it from different, perspectives and different angles and whatnot. But as long as we can accomplish the thing we've agreed to accomplish together, the rest shouldn't matter as much.
Shouldn't.
It does.
Shouldn't.
But
It does.
shouldn't.
And I think, again, wearing my sociologist, anthropologist hat, people look for they do look for connection. They look for shared history. I do that myself. I have a pretty unique background, right? You and I know one another. I'm not your standard, 49-year-old white guy in terms of my life experience. And I'm okay with that, right? I'm okay with that. But I think they do want to find similarities with one another, right? I think we're sort of seeking that. And in the workplace, it's even easier to do because we're hopefully working towards the same goal. And so if 9 out of 10 of us drink wine at a holiday party, well, we're kind of wondering what's up with the one that doesn't, right? Or whatever it may be. And again, no judgment on what people do, but why aren't there multiple options, right? It seems like, and I do just want to mention this time of year, we work with a lot of companies, especially around holiday time. If you are going to have a holiday party where alcohol is included, just give people rides, invest in Ubers and ride shares and Lyfts and stuff like that, or a designated driver, because nobody needs to be out on the road. And motor vehicle, we know as safety professionals, motor vehicles are the most reason for injuries and accidents in the job site. So just take that element out. Have your holiday party, serve whatever you're going to serve, add some ride shares and Lyfts and coupons, depending on when the show is going to air. I know you said maybe later, so if you need to edit this out, that's fine. But if there's one takeaway, if it's going to be a corporate sponsored event, just have some motor vehicle services available for folks. So,
do you need more psych health and safety in your life? Then head over to the FlourishDX Academy for several free on-demand e-learning courses. If you're an internal professional, follow FlourishDX on Eventbrite to register for any of our free fortnightly interactive webinars. Our flagship professional practice program is also exclusively available for internal professionals. The 12-week course blends theory, applied practice, and interaction with other professionals through live lectures and a monthly community of practice session. Find out more about all these learning opportunities or inquire about a bespoke in-house training at the Flourish DX Academy. www.45003.org. Now back to this episode.
I will say that is a universal message because there are celebrations going on all throughout the year. Somebody got promoted. We did a merger and acquisition. We're having the annual whatever it is. And, you know, as you've mentioned, and I've shared with you, and I'll share it again for the group. In 32 years active in the fire rescue service, I can't ever recall a social gathering where alcohol wasn't involved. And I was not a drinker. So some of them I didn't get invited to. And, you know, again, to your point, I think I'm okay with other people. I go to bars, but I'll have a mocktail or I'll have a soft drink. And I'm not judging anybody who's there. But I don't think we should be excluding otherwise capable, qualified, contributory people because of that one thing. That's what and similar, because we have a person that we discover, they disclose that they're in recovery, why do we all of a sudden now treat them some kind of different way when they presented for to be hired? We hired them for some reason. They had some knowledge, some skills, some expertise. And then we look for a bunch of other reasons to exclude them. Honestly, whether or not you had a criminal history or not, whether or not you're in recovery, whether or not you have a disease, I'm not sure why any of that matters, to be quite honest. I struggle from an HR view perspective. Does the person have the knowledge, skill, and ability to be effective in this environment? And the things that are important that we should be screening up front. If there's some reason that it affects this job, great. But what does it have to do with this job in this organization?
True. Not to mention, having worked in for-profit businesses and nonprofit and now academia, teams are stronger when they have people with a variety of different backgrounds. Like my program would be stronger if I had some formerly incarcerated individuals that were working as part of my program. I know that straight up, right? Like we don't currently have anybody. Like I'm connected to some of those groups, but there's nobody, currently working with us. And so like that's the reality, because that's what life looks like for people in restaurants and construction and in a variety of sectors and industries, right? So we do have medical professionals in recovery that are connected to our work that helps us be more involved in the medical sector, similarly in other professions. And so I'm always a fan of and I find that's what I find most interesting about life is meeting people from more types of backgrounds rather than more similar to mine. But that, it gets into how do we define what a recovery-friendly workplace is, which is I know is part of where you want to go here, is like, it's a company that recognizes that someone in recovery is an asset. This is an asset to the organization. And you mentioned why does the company act differently? I do think also just on my own history, in order of comfort level, it was the easiest to disclose high cholesterol and then pre-diabetes. Generalized anxiety disorder, it took me a minute and a little bit of age to feel comfortable with that one. And then the co-occurring with generalized anxiety disorder was cannabis use disorder. It took me a long time to feel comfortable with that one because addiction is an isolating disease, right? I mean, people who use psychoactive substances and have addictions and this as their medical condition, it's usually not a social activity anymore. It's very solo, individual, and somewhat isolating. And so there is, when we talk now about communication, and I was just at the hospital on campus today, communication is a two-way street. And so these recovery-friendly workplaces that are working with us in Colorado are saying, we want to change the script. We want people to bring this forward. We want to have these trainings available. We want to talk with you, David, and do the work on changing our policies, programs, and practices. We are ready to tackle this like we are any other condition. And we also need people to raise their hand and say, I need help. This is something I need help with. And they're raising their hand when they get diagnosed with cancer. They're raising their hand if they have type 1 diabetes and sometimes type 2 diabetes. They're raising their hand to get prescriptions around hypertension and to get accommodations. But yet, we're not yet at a spot where people feel comfortable raising their hand and saying, this is part of my medical background. And that's concurrent with how my own history is. And so I get it, right? We're not at a place now, it's not just the work side of things, it's also the individual side of things of being willing to bring it up. And our hope is the more companies, the more leaders start getting the badge, start talking about things differently, start implementing the training, start changing the language they use, start rolling out new policies that are less punitive. The workers, the middle managers and the essential workers will be like, oh, things feel different here. And then they'll start to hear more people, just like they did around near misses and other safety reporting, like, oh, I can do that. I can bring that up too and get support, get help, and it's not going to cost me my livelihood, right? And so that's the goal, is the company recognizes a variety of strengths and assets for individuals in recovery, including the type of attention to detail that individuals have, the reliability individuals have when they get to stable and sustained recovery, the amount of teamwork it takes. I mean, you need a pretty strong social support network to live sober for a long time, right? Like it's easier to be isolated and use psychoactive substances than to live sober. You kind of need to be a team player in order to make that work. And so there's a lot of assets and a lot of qualities that individuals come into the workplace with that are in recovery. And our hope is businesses, and I think a lot of restaurants and construction sector partners already get it. We're starting to see some other sectors start to move the needle on it too. Not to mention, addiction is here, and substance use disorder is here, and it's not going anywhere, and the rates aren't going down at all, right? Like, new substances are coming out, there's new drugs on the street, there's new prescriptions that people get dependent on, and so the disease isn't changing. We're not making a lot of headway on it. I know a lot of addiction treatment specialists that are working on it, but we're still in intervention phase on this. We're not in prevention phase, and so companies, I think they're realizing we need to approach this like we do other medical conditions. It's covered in our benefit plans. We need to understand that. We have employee assistance programs. Maybe our leaders start talking about it differently. We have different policies in place. And so what a recovery-friendly place looks like is everything from how we approach the holiday party, to what types of conversations we're having, to what does our drug-free workplace policy look like, to we have Narcan and naloxone in our first aid kit. If just like we have a fire extinguisher and an AED, we're not saying we're not going to treat someone with an opioid overdose. We're going to have the thing in our first aid kit that would save someone's life, just like we're going to have an AED, and we're going to have an EpiPen if we need it, and we're going to have a fire extinguisher. And again, we'll deal with the fallout of if it really was an opioid overdose down the road. But we're going to save somebody's life, and we're going to have naloxone in the first aid kit. And a recovery-friendly workplace can be one of those things, or it can be all of those things. It's kind of a full menu that companies choose from.
Right. Yeah. Well, as I listen to the aspects of recovery-friendly workplace that you're speaking about, each and every one of them also has a benefit of creating a psychologically healthy and safe place at the same time, because that's what it's about. I mean, it's very similar. People will tell you that, well, there's a slip hazard. They'll tell you that the room is too hot or too cold. They'll tell you that, I smell smoke, but they won't mention the fact that I'm feeling stressed by this way that someone is, interacting with me. My workload is too heavy. And because there's a stigma that goes along with, well, why don't you just take it like the rest of us do? Well, that doesn't make me a lesser person, because I just see it different. That's all. It's also not saying that the workload itself is a problem. It is just hazardous to me based on what's going on with me. And that's a total kind of a mindset change. Most physical hazards affect virtually everybody the same. The chemical is going to burn. It's a caustic soda. It's going to do this to anybody. But psychosocial hazards are just different. And, I guess, I'm sure what I'd love to see is workplaces that are built around human beings and not trying to force people into something that was created by whomever 50 years ago. Because a lot of these policies, they were written in the 60s and 70s or even 5 or 10 years ago by different people who aren't even here anymore. Some of them aren't even alive. And these organizations will go year after year after year. This is our reasonable suspicion policy. And it doesn't fit anybody who's there now. No, nobody. So why not change it? Well, we can't. No, actually, we can.
Well, that's a big, I mean, oftentimes the first thing we do in terms of practical, what this looks like and working with the companies, is a policy review. And, we talk about the Drug-Free Workplace Act of 1988. Any company that receives federal funds, that act requires anybody that receives federal funds to have a drug-free workplace policy and to provide some form of education and training. I will say in Colorado, most of the policies we see did at least get a review once we legalized cannabis in Colorado too. So that it wasn't, some policies I see were straight up written in 1988 or 1990, and other ones had a little bit of a review. But what often I see is zero tolerance, it's punitive. And my first question is this what really happens? And most companies are like, no, actually, that's really rare that's what happens. I'm like, well, okay, and so then the conversation is, well, what happens? Well, we remove the person from the job site, we do the drug screening, we collect our evidence and data, we oftentimes have like a second chance or a last chance or a fair hiring agreement, we put accommodations in place, we do all these other things. I was like, well, your policy just says pretty much zero tolerance. It doesn't say any of what you just told me. And so if I'm looking at it as an employee and I'm looking at your handbook, I'm going to think, well, I'm going to get fired if I tell anyone what's going on, even if that's not what's going on. So why not have the policy align with what's actually happening rather than, and I think people just get a little bit nervous. It's this idea that, the few bad apples, and it's usually even less than a few, it's like the 1 out of 100 bad apples are going to ruin it for everybody. I'm like, well, it should be written for the 99.5 that are actually going to follow the policy instead of the, few who are going to misuse it. But that's not generally how we write policy for some reason. And so most of the time the companies agree with me. We go through a review and we start to reformat. It still has, and this is what we started with, their termination could be the solution. In the beginning, so many companies said to me, David, if I have to fire someone who's in recovery, can I still be a recovery-friendly workplace? I was like, absolutely. But it was a really heartfelt question, right? But if somebody had multiple chances, they followed the policy and it's not working for them. Like, again, safety is the grounding thing. You got to make sure the workplace is safe for everybody. And so, yes, there's compassion, but there's compassion to a point. Right? And if the person literally can't fall within a reasonable policy and that you're providing benefits for, well, yeah, unfortunately, termination may need to be the case so that person can go get the actual medical treatment that they need so that they can be a good employee somewhere else, or maybe they come back. But I got that question so much in the beginning. So.
Yeah, I want to, so again, you make me think about, this statement I often use. Sometimes the best thing we can do for people is help them be successful someplace else. I mean, this environment that we've created based on the way we do it here, they're just not going to be successful. We have tried all of these things. And if you think about the hierarchy of controls for total worker health, focusing on the person is the last thing, not the first thing. There's a bunch of other things we should have done before we get to the point of helping them be successful, working someplace else or doing something else. But again, my concern, my observation, and the challenge is sometimes people skip over because focusing on the person is easy. I mean, what you're talking about, a recovery-friendly workplace, is not easy. I don't think it is. I think it takes work. I mean, it's going to take focus. It's going to last over a period of time. And so what is it about this that got you interested in having these conversations with workplaces?
Well, let's be straight up. It was fundable, right? Like, opioid settlement funds are a reality, and recovery-friendly workplaces is an important situation for part of the whole opioid use disorder crisis and epidemic that's going on in our country, right? Like, when people do recover, and most people recover, I think this is another myth that you experience homelessness maybe for a small amount of time, and then you have a home. You may have a substance use disorder, or you may have cardiovascular disease. Maybe that one's not the great example. You may have cancer goes into remission. You have a substance use disorder, but then most people recover and they get treatment. And so part of the treatment around opioid use disorder and part of this concept of recovery capital. So recovery capital is like this Venn diagram of all the things that support someone's recovery. There's social support, there's financial support, there's human capital, there's, my connection to community, there's the alignment of like schedules and purpose and meaning in life. There's so many elements of work that actually really translate well into what successful, stable and sustained recovery look like. And so for me, as a researcher now, because I'm getting my master's in public health and I needed a research area focus anyway, so it aligned well not only with my own personal experience, but also with funding and how to work on certain health and safety topics, and also research. There's not a lot of research out there on what it truly means to support a worker in recovery, right? And I will mention here, you're right that it's hard for workplaces and it's not easy. One of the big challenges I have as both a researcher and in doing this work with HR managers is your definition of recovery may be different than mine. And so it's not like type 2 diabetes where we have an A1C number and we are diagnosed with type 2 diabetes or as a pre-diabetic, right? Or we get a screening and the cancer cells are in our body or they're not. Recovery is all over the map with what the definition is. And I think that makes HR and safety professionals a little bit nervous because David's recovery might be really different from David A's recovery might be really different from David B's recovery. And I think we're looking for standardization. It does take a very independent, human-centered approach, and it's work. It's hard. It's cumbersome. And while I fully agree that most people are going to recover, in that experience, they're going to have some return of symptoms throughout the and recurrence of use. I don't use the term relapse, but relapse is the prevailing word here. It's not going to look straight. It's not going to be linear. It's not going to be like when the cancer goes away, it never comes back. The reality is it could come back. And in the first couple years, it does come back. It takes a minute for people to rewrite neural pathways to start coping with stress in a different way. So I think these are all the factors that make it complicated. But the reality is, again, substance use disorder, there's a lot of people with mild, moderate substance use disorder working in the workplace right now. There's a lot of people when I have these conversations and I describe what a substance use disorder is, will come up to me afterwards and like, I'm looking at my own usage a little bit differently now that I know what some of the criteria are. I don't know that I have this on my medical chart, but I could see how times in my life I may have, or at times in my life when I'm coping with my stress, I could be on my way to that. And so thank you for bringing up more about what a substance use disorder really means. And so because there's so many workers that already have this condition, the estimate is like 29 million US adults right now, maybe 30 million with a substance use disorder in the workplace, like one in I guess 6, 18 and up US adults, or 1 in 10, depending on which way you look at the US American population. It's a big number. And because most people recover and most people want to work full time, you add to that the people who are in recovery, which is this multiple of people who have active substance use disorder. So there's just a lot of people. And so I think the benefit to the workplace is we should talk about it, and we should get people care and treatment, and start to bring a light to it, just like we do now anxiety, depression, some of the mental health things we're talking about. So
that's right.
Yep.
That's right. There again, just so many parallels when we talk about substance use and recovery-friendly workplaces. There's just so many parallels to the conversation that I have here about psychosocial hazards, that there are those out there who don't believe that they're a thing at all. I mean, how you feel at work doesn't matter, because this is what we've been told. You've got a job to do. How you feel doesn't matter. And I'm here to suggest, yes, it does. And that's an indicator of how safe this environment is for the person that you actually want to accomplish. It doesn't feel safe to everyone all the time. It just doesn't. And the question is not, whether or not we can eliminate all that. You can't. I mean, just like you're not going to be able to eliminate substance use disorder. You're not be able to eliminate, as much as we're working on it, we haven't eliminated cancer and diabetes either. So these are things that humans are living with. Why isn't the workplace designed around the humans and what the humans actually are, what the humans are actually experiencing it, and we work around it to get the best out of that person and to have them have an experience. You shouldn't go home the same way that you came to work. You should go home a little bit better. You should. Because technically, if I come in good and I made a few extra bucks, why isn't that better?
Should be. And I want to say, David, it's not just psychosocial hazards. If I work at a restaurant or bar, there's a physical hazard of the substance is right there on the shelf.
Totally.
Or a cannabis dispensary. Or if I work in the healthcare profession, narcotics are part of the job. And so it's not just psychosocial. There are also legitimately jobs where the physical availability of the substance is a straight up risk exposure. It's just a straight up hazard because it's there, right? And so some of it is behavioral and psychosocial, but some of it, and for some workers is, and now it's in grocery stores, right? Alcohol sales, right? And so sometimes the hazard is actually just right there too. It's not just psychosocial.
That's right.
So
That's right. That's
yeah.
right. That's right. Yeah.
Mhm.
And so again, in thinking about, these recovery friendly workplaces, how in your view, as we, start to wrap, this other little activity we're both, you're certainly more involved than I'm a newcomer to this conversation about total worker health and recovery friendly workplaces. I think there's a connection. How do they connect?
Yeah. Well, they connect in the fact that it's both design thinking instead of focusing on the individual, right? And my own research on recovery friendly practices is around that as well, right? Like, what are the systems that are contributing to the disease and or buffers or supports for people maintaining successful recovery? How do we look at this from a hierarchy approach in terms of providing supports in the workplace and mitigating risks? I'm not saying we're going to remove the risks and hazards. It's the same thing we talked about with holiday parties. We're not saying close all bars or stop all sales of cannabis. That's is not a reality, nor is that what I'm advocating for. I'm not a teetotaler. I'm not an abolitionist. That's not what I am or who I am, right? I'm a realist. And so I'm looking at, okay, well, what does it really look like? And how do we mitigate stress for individuals? And how do we start to look at the system level of how people are coping and handling stress? Another practical thing that we talk with a lot of companies about is I think if we did more fit for duty testing and screening, like something you're familiar with, especially in industries that are high exertion, we'd probably screen more people to know more about what's going on with them before coming into the job. I'm not saying that they can't get the job, but like in healthcare, especially with nurses and doctors, I've been, oftentimes I'm like, if we could just get them a little bit more information before starting these very difficult shift schedules, we could probably prevent diversion of opioids 10 years, 15 years down the road, because people would have more information about their own. It's like when I wore a continuous glucose monitor for a study. When I knew my own body's reaction to glucose, I could make better choices throughout the day. So if we can get better data and get it at a system level and start giving it to people, people are going to make better choices, right? And so the similarity between total worker health is like recovery friendly, as you're mentioning, it's total worker health in practice. It's really, total worker health is a broad umbrella, and it incorporates all sorts of health and safety standards and supporting human beings in their work experience. And for me, this is just a category that continues to grow in terms of a condition that really not many people are talking about, but really we need to shine an additional light on. And also, we want to focus on high risk and underserved industries. Now, total worker health is broad. It goes to any industry. But in reality, there are some sectors like construction that I mentioned where a lot of people are dying of unintentional opioid death, right? In Colorado, by far, the industry with the most amount of unintentional opioid overdose deaths are people who work in construction. And so when we look at sector-specific death now, in addition to disease, well, and that's why construction is working on it, because they have to, right? Basically, what the 287 people died in 2023 in the construction sector from an unintentional opioid overdose. So one person every day of the work week, Monday through Friday, that was a construction worker. I'm not saying they died on the job site, but in that sector, and it's almost double any other sector in Colorado. Right behind it is restaurant and hospitality, and that's another sector where we're looking at. And so when we think about the hierarchy and the total worker health approach, and we put on our researcher scientist hats, we're like, there's an issue. There's something there that we can do some more research on. We can provide some more resources about, and the hope is we change some of these cultures and down the road, and why opioid settlement funds have been streamlined into this program is we're hoping we reduce death down the road. Honestly, I think that's the same with any safety thing, right? We want to prevent risk and we want to reduce catastrophic incidents. And so in that sense, total worker health and recovery friendly are completely aligned.
Absolutely. Absolutely. Wow. So let's say there are folks out there who want to learn more about this that may not, obviously, if you're in Colorado, you're probably pretty accessible. But so how can folks learn more about the concept of recovery-friendly workplaces?
Yeah, the best place would be our website, which is CO, like Colorado, capital C, capital, or CO rather, recoveryfriendlyworkplace.org. So CO, recoveryfriendlyworkplace.org. We've published a lot of resources there. There's also a map on the homepage. There's 36 states that have an initiative like ours. So the reality is the majority of us live in a state where there's some form of initiative going on, and all those states are hyperlinked in the map on the homepage. So you would get some more background and information about what we're doing in Colorado and how we're putting it into practice, but also there's a map there that you could connect to any state. People could also reach out to me directly. It's david.shapiro at this really long handle, CU and shoots, ANCHSCHU.tz.edu, and you can type that in for your listeners, but I'm happy to have conversations with folks about what this looks like in practice as well. And I'm often invited to other states and to companies outside of Colorado just to give some background and perspective on what we're doing. I'm happy to do that or connect people to their state. There's also a national recovery-friendly workplace initiative going on. That's out of a think tank out of DC. And so the National Recovery-Friendly Workplace Institute has their own certification, is working with companies that have offices in multiple states. Right? Not every company is state-specific anymore. In fact, so many are global, and that contributes to additional issues of how you approach sensitive topics. And so the movement around this is really growing, and there's a lot of resources being dedicated to it. Each state does it a little bit differently. Clearly, my own background and knowledge set is mostly in Colorado, but I'm pretty well connected to most of those other states as well, and happy to refer people over to resources.
Wow. Oh boy. Well, David, thank you very much for taking us on this journey and this conversation regarding recovery-friendly workplaces. Again, it's another one of those topics that I knew some work was going on out there. I didn't even really know what it was called, but have learned a lot about it. And I also wasn't aware that there is so much work going on across the country. I mean, there are some days that you can get kind of, if you look close to home, you can get kind of down on what's going on in the world. But on the other hand, there are a lot of efforts out there, even to create these kinds of workplaces that we want to see in the future. It takes work, and it's going to take, I don't ever think it'll be perfect, but it's just wonderful to see people thinking about this particular aspect. This is something I wish that would have been around for for both my uncles and my grandfather, for example, back in the 60s and 70s and 80s, when they were, coming home from work and just, really kind of struggling and never really got any help. And I just wonder some days, had these kinds of supports been around, would they have been able to get and maintain employment, but thank God we're here, and there's a future for our, for the next generation, the generation after, that these systems will be set up. So really appreciate it.
Absolutely. I'll leave you with this quote from Johann Hari. He wrote a book called Chasing the Scream. He's a journalist. It's a great book on the war on drugs and how some countries are doing things differently than America. But the quote that we like to bring up is the opposite of addiction is connection. And oftentimes we think the opposite of addiction is sobriety or abstinence. It's not. The opposite of addiction is you and me being friends. For me, it's connection. And the other thing I like to say is we recovered together. It's through connection, and it's through some of these partnerships with other people in Colorado, around the country, through these support networks, that actually we conquer this disease. It's just like any other disease we conquer. There's medical research going on, but this is one where human connection and social support is super critical. And as an extrovert and as a cultural anthropologist, I think it really aligns with who I am. So I'm honored I get to come and talk to you. I'm honored that we get to be friends and have these conversations. So thanks for the invite today.
Yeah, thanks. Thanks very much. Wow. Okay. If you're watching or listening to this podcast for the first time, hopefully something you've heard will bring you back to an episode in the future. Previous episodes can be found at psychhealthandsafetyusa.com. You can watch, like, subscribe, and share the podcast on the Flourish DX YouTube page. And please do join the Psych Health and Safety USA movement by connecting and becoming a subscriber on LinkedIn. So until next time, stay tuned and look out for the next episode of the Psych Health and Safety USA podcast. Tune in each week for new episodes of the Psych Health and Safety USA podcast. If you have a story or know of one that needs to be told, reach out to us on LinkedIn or send an email to David at id2-solutions.com or go to the Flourish DX website at flourishdx.com. We'll see you next time.